All right, welcome everyone to the Leonard Davis Institute of Health Economics. I am Rachel Werner, LDI's Executive Director. As many of you know, one of the core functions of LDI over the past years has been to bring people together on Fridays at noon to talk about important topics in health policy and in research. But we're now obviously living in unprecedented times that prevents us from getting together in the same room for those seminars. Nonetheless, we wanted to continue the important work that LDI does of bringing people together for important conversations. So over the coming weeks, or possibly months, we will be organizing a series of virtual seminars that will cover topics including COVID-19 and the anticipated aftermath in terms of healthcare delivery, and the economy. Welcome to the first in this series. Thank you all so much for participating. And with that, I'm going to turn it over to Dave Grandy, who is LDI's Director of Policy, to introduce today's seminar.
So let me start by saying that all of us are certainly thinking about those among us working on the front lines of this pandemic and all the people that are being directly impacted. It's hard to see what is going on in Italy and New York City right now and not have a real sense of urgency. So we begin today with our first event focused on important considerations for policymakers in the fight against this pandemic, and not just looking back on what has been done, but really trying to think about what needs to be done in the coming months. I also want to mention that we do plan to hold future virtual events addressing COVID-19. We're working on putting together some events right now. We have one additional one on the calendar on April 17th. With Athene Venkataramani, an LDI Senior Fellow and Health Economist, who will discuss the health effects that may come not just from the direct health impact of COVID-19, but a lot of the economic devastation as well. We do have an outstanding lineup today. I'm going to go ahead and introduce our moderator, is Dan Gorenstein. Dan is executive producer and host of Tradeoffs, a health policy podcast that's recorded at Penn, which is really focused on bringing rigor and evidence to health policy debates. And so certainly we find ourselves in a time where that needs to happen. And so I encourage all of you to subscribe to Dan's podcast. But with that, let me turn things over to Dan, and then we'll hear from our panelists today.
Thanks, Dave. I appreciate it very much. It's a pleasure and an honor to be here. This is a very important moment for all of us. This is a community. This really is a moment for us to come together and find some communion in the togetherness. And that's a really exciting, wonderful thing to be able to have. I'm honored to moderate this panel, and I just want to, as a way to sort of frame up the larger conversation I think that we're having today, I think what we're really looking forward to is, what does the future look like? How can we think about social distancing and the spread of the outbreak and the economic impacts, as well as what vaccines or treatments may be in the pipeline? These are all questions and ideas that we'll explore over the rest of the hour.
I'm Susan Ellenberg. I'm a professor of biostatistics and interim chair of the Department of Biostatistics, Epidemiology, and Informatics in the Perelman School of Medicine.
Richard?
Hi, I am the Director of Policy Analysis of the Penn Wharton Budget Model and an economist.
Allison?
Hi, I'm Allison Buttenheim. I'm an associate professor of nursing and health policy here at Penn, and also part of our Center for Health Incentives and Behavioral Economics.
Mike, let's start with you. We're seeing news reports suggesting new hotspots popping up: New Orleans, Boston, Chicago, Detroit. Is this pattern consistent with your modeling, and are there any surprises compared to what's happening on the ground?
It's consistent with what we've seen in many other countries, where we had some cities be earlier than others, and there's kind of a lag. And, Philly, we're 2 or 3 days behind New York City, and then Washington, D.C. is a couple days behind us. And I think it's not anything that we weren't expecting.
I had a conversation with a healthcare executive in San Francisco who's saying that they've been bracing and waiting for the tsunami, and that numbers for the past week or so have been holding steady. And he was saying he's cautiously optimistic. This is Bob Wachter, who some people on this call might know. And Wachter was saying, we think maybe our social distancing that we adopted early might work. Is that right, Michael, or is that sort of wishful thinking?
I think that's wishful thinking, and I hope that our social distancing is working, but I don't think we're going to be able to see that yet. We've talked a lot about the lag in the time we start social distancing, and we could expect a decrease in confirmed cases and a decrease in hospitalizations. But there's an additional lag because we're social distancing, but we're still going to have transmission within households. We're still distance from the others, but there's still a lot of connectivity within a household. So it's gonna be a while until we can tell if it's working.
It feels like we're just in the foothills of the outbreak at this point. Is that right?
Yes, that's a good analogy.
Sobering. Thank you. And Susan, let's turn to you on that point, because obviously time, as many of us sort of sit in our homes and sort of wait and hold our breath in some way. Can you help please paint a picture of the landscape right now? What are drug makers doing? What are they thinking about? What is the response from industry right now?
Well, I think there's been quite a big response from industry and other places. There are lots of treatments being evaluated right now. The World Health Organization is just about to start, maybe it's already started, a large multi-arm trial, a global trial of a number of different products. In recent days, we've heard about trials of convalescent plasma being started. That is plasma from people who have survived the infection, who have built up antibodies that may help. We've heard about Gilead's remdesivir, an antiviral drug that was studied for Ebola, didn't seem to work, or certainly didn't work as well as some other treatments. And that's in a number of clinical trials, one big one that the NIH is doing. And then there are other treatments that people are looking at. So the good news about treatments, we're thinking about clinical trials that often take a long time before you have an answer. But we're going to know fairly quickly for each patient in a trial what their outcome is. We're going to be able to see whether they're increasing need for oxygen, whether they're going into ICUs, whether they're getting better, how long it takes till they're discharged from the hospital, and of course mortality. We're going to see those answers, those numbers, those data in a relatively short period of time. And so these trials, I would not expect to have to take a very long time to complete. There's lots of people who have been identified and who need treatment. So I think we'll be able to accrue these trials fairly quickly, and we should get answers. In fact, I think they're expecting answers from one of the first trials of remdesivir that was ongoing in China sometime in April.
Put that into context for us. Some of the reports that I've read have suggested that the pace of the inquiry, the scientific inquiry, is actually off the charts here. Is that right?
Well, I certainly, it's true for development of drugs and vaccines. Many, many people are interested in that, and there's a number of different places where they're developing vaccine candidates. One advantage we have is that there's been a fair amount of effort in looking for treatments and vaccines for Middle East respiratory virus or MERS, and that is a coronavirus that's similar to the one that we're experiencing now, SARS-CoV-2. And so there's a little bit of a head start in terms of agents that have shown activity against the MERS coronavirus that are good candidates to start studying now.
So when you think about a timeline in your own mind, if a loved one or a family member, a friend, a neighbor at work asks you, how soon before we get something, what answer are you giving people?
Well, it's possible that if remdesivir looked fantastic in the Chinese trial that's going to report in April, and if people look at it and it looks like a good high quality trial, it may be available quickly. Now that's sort of a best case scenario. Usually drugs are not super blockbusters, but every once in a while we luck out. But I would think that in the next 6 or 7 months we'll have answers on a number of these agents.
Susan, 6 or 7 months, some people will probably hear that and want to tear their hair out. Can you just help give some context? Why do things take months Why does something take maybe a half of a year?
Well, that would actually be very fast to complete a clinical trial. You have to enter the patients and you have to see what happens to them. They're not all going to be entered on day one. It may take a couple of months, and that would be very unusual to do it that fast, but we may be able to do that with the number of cases that are going into hospitals in a number of different cities. And then we have to wait probably a month or so to get answers for these patients, depending on what the endpoint is. But again, I said these are going to be short-term observational periods to see whether people are getting better or worse. 6 or 7 months is the time frame where the epidemiologists are saying, well, if it eases off in the summer, it may come back, in the fall. And if we have some good treatments, we'll be prepared. Thinking about if we have some good treatments, where people who get sick and start to have symptoms and even need to be hospitalized, and we can treat them effectively with these treatments so that they don't have to go to the ICU and they don't need ventilators and they don't die, we'll all feel a little more comfortable with what's going on. As we know, most people who get infected don't have severe symptoms and can get over it like they would with the flu. And some people are even asymptomatic. So if we have a way to treat effectively those people who have more severe symptoms, I think, that will do a lot to ease concerns.
Thank you. Richard, Congress is on the threshold of passing a $2 trillion package. Before we get into winners or losers, just give us a baseline. What are the key, as far as you're concerned, what are the key components of this legislation, historic legislation?
The checks. I mean, sending, a very big, a big portion of the people, $1,200 for adults, the $500 for kids. That I think is the biggest piece. I mean, I think, because the people we're talking about here are people that can't go to work. They're the people that need it. They can't, like us, work from home. I think the other big dollar things are some of the small business loans, I think, is maybe we can dive into, but I think sort of sustaining those businesses in, that maybe only have 2 or 3 months of runway, getting them through this time where essentially we're asking people to shut off the economy for a period of time is important. And so I think those two things are the biggest pieces. Maybe obviously, but I think, that's where I would start. And, if we're talking 6 months that we're going to have to do, say, social distancing or have the economy shut off, we're going to see multiple rounds of checks, I think. Not just going to be the one, $3,600 that a family is getting once. We're going to have to see that again, I think, if we're talking, any extended period of time, 4, 5, 6 months.
You just said a very interesting phrase there. You said the economy, if we have to have the economy shut off. As an economist, is that right? Is that oversimplifying it? What do you actually mean by that phrase?
It's probably not right, and it's definitely oversimplifying it. I think the way, when we think about recessions, and of course, where we're starting with is that we are going into a recession, we're in a recession, is typically we think of something happens and it causes a lot of businesses to close. Financial markets collapse, businesses close, people lose jobs. Now what's happening here is that we're asking people not to go out to restaurants, not to go to the big box stores and buy new TVs. We're asking everyone to stay home and just do what's absolutely necessary. So all of those businesses, again, restaurants, breweries, like all of those things that require people to come in, are suffering. And so we're asking, again, looking at, our economy, a big portion to say, hey, you've got to figure out some way to get people, a lot of restaurants take out food, things like that. Hotels are shutting down. That's what I mean by shutting off. Again, the set of people may be listening, and certainly me, I can continue to do my job. I would say, 100% working at home. I can't, if I'm a cashier at Best Buy. Like, I can't do that from home. And so that huge portion is getting shut off. And to me, what the government's doing now is paying people not to go out, right? It's saying, hey, look, we know that you're not going to get checks if you can't work. So here's some money. We're going to give incentives for the businesses to keep you employed and pay those, keep paying your salaries or your paychecks. And let's see how far we need to again, kind of shut off the economy.
Great. Thanks for that. And we're going to come back to some of these economic questions. I would like to bring Allison in here, and we're also getting some questions from the audience, which is awesome. And we're going to get to those after one or two questions here with Allison. Keep those questions coming in, folks. Allison, for many of us, social distancing is new. Is there any research or past experience that can be useful in thinking about how we social distance? Is there data or evidence to help us inform this moment?
Sure. Well, oddly, some of the best evidence we have comes from the 1918 influenza pandemic. The flatten the curve curves that everybody has seen a million times that are now animated and are sometimes made out of cats, because that's interesting. Those come directly from a comparison of, I believe, Philadelphia and St. Louis from 1918, showing what happens if you do social distancing measures early versus if you wait just a little bit for more cases to emerge, how much of a difference you can make. So I was sort of surprised when the epidemic got going, how much we were relying on data from 100 years ago, but it's pretty compelling. I think the other place we can look for insights is behavioral science. Now we're asking people when they go to the store to think about keeping a 6-foot distance from the person in front of them in line, or if they have to access health services, to try to keep those waiting rooms uncrowded. And I think there's a lot from behavioral science that tells us how to make that really easy for people, how to give visual cues. We've seen cool pictures of, dots on the floor or chairs set a certain distance apart, because those are hard things. This is new for everybody. And we're gonna misestimate what 6 feet is. We're gonna, depending on the setting, not think it's very important, not remember to do it. So the more we can sort of set up environments for people that make social distancing easy and straightforward and sort of automatic, I think the better job we'll do.
I'm going to turn to these questions. The first question in the queue, it's from, and if I have mispronounced your name, Ed, I apologize, Ed Lowenton. Since viruses do not survive long outside a suitable host, would a sufficiently flat curve of new infections starve the virus and reduce spread below a critical value? Or will the pandemic have to burn through the available fuel until a critical number have either survived, died, or been vaccinated? Michael, I suspect that's a question for you.
Yes, that's a great question. So, if it comes to that, then flattening the curve is still burning through the population. It's just doing so much slower. It's a slower burn, and hopefully it'll extend long enough until, as Susan mentioned, we have treatments. So hopefully we won't all, even if we all burn through the population, we won't have it as many severe cases. And of course, if we can extend it long enough until we have a vaccine, even better. We've talked a lot about flattening the curve. We've also, Susan and Zeke Emanuel and I have written about pumping the brakes, where we might expect social distancing to ease up once we have fewer cases and the virus to reemerge and to reinitiate social distancing, so that it may not be a flat curve.
I'm going to read the next question. It is from Wendy Ruderman. How should families living in poor neighborhoods cope with social distancing, with kids who need school for structure and food feel lost?
I'm going to guess that one's headed to me as the token social behavioral scientist here. This is such an important question, and one that really, I think, played into both New York City and Philadelphia's decisions about when and how to close schools, because we know many low-income kids get 2 of their meals per day in school. And I think we've had to be careful and creative in thinking of ways to make this incredible burden of social distancing and stay at home workable for families that don't have the resources, to make this an easy thing. No easy solutions here, but we've heard, I think we've heard some great stories, some great anecdotes of policies that have been put in place to make this a little bit easier. In New York City, and I believe in Philadelphia, there are some childcare opportunities still open, mostly for families whose adults are essential workers. There have been really creative ways to still get kids fed. I heard of a school district in Oregon that was running the school bus routes midday with the school lunches on the bus, and you just showed up at your regular bus stop and your meal was handed out the door. And there's also the whole issue of, how am I supposed to homeschool my kid? And I think the advice that's come across, social media and from schools and educators is, don't try to homeschool. Homeschool is not what we're doing right now. Sort of do the best you can to keep your kids safe and engaged in something. Maybe that's cooking. Maybe that's going for some socially distanced walks around the neighborhood. But you don't need to teach fourth grade math, and I think that putting that burden on parents right now is probably not very helpful.
If I can add there with the New York City, I have a sister who works in the school system there, and I think recently they've made it so that kids can pick up 3 meals at one time in the morning, and so I think those sorts of things I think are like you say, creative, and I think will be helpful.
There was another question that came in, which I think has been a big source of controversy in the press, which is like, should we allow lower risk people to just kind of go out there in the world and get infected and do more targeted efforts toward people who are higher risk? So exercise very strong social distancing measures among those most vulnerable, and in some sense, like send the kids to school, send the young adults, I guess, back on spring break, and let immunity develop in the population. So I'm wondering, and Michael, maybe this is for you, Allison, maybe for you. Maybe let's start with Michael, and then maybe Allison, you can jump in.
I don't think that's a good idea. I think low risk people are connected to higher risk people, and I think it's not even super helpful to suggest this. I think what we will have is a lot of people becoming infected, whether we want to or not. And of course, once we have a test, for a serological test, we can tell who has already had the virus, and then we could think about those individuals returning to the workforce.
Do we know the role yet that kids are playing in transmission? So I know a big source of controversy is around school closures. Do we know at this point anything about transmission and the role that kids play? Michael?
I would like to know a whole lot more. I think we know a little bit, but not enough to make a huge policy decision on. I don't think we know enough yet.
So we shouldn't open the schools yet.
Doesn't seem like a good idea right now.
Okay. All right. Susan, you've written about, obviously you spoke earlier about the idea of doing good science during a public health emergency like this. I'm curious, I know you've looked at this back with the Ebola epidemic as well. There is a sense of chaos to some extent in healthcare delivery where things are really surging. And so, is it possible to be doing science in that setting?
Well, it is possible. It's certainly more challenging. It's perfectly natural for people who are in very advanced disease situations and their families and the doctors who are caring for them to want to do something. We have very good standard of care. At least we would if everybody had the ventilators and respirators that they needed. But what we've learned, not just from Ebola, but from the early days of the AIDS epidemic, that we must do carefully done trials to understand what actually works. If this group is trying this and this group is trying that, and they think that they see some people are getting better, and maybe they think it's more than got better last week, you can't make good decisions about what actually works on that. There were many things that were tried in the early days of the AIDS epidemic, and the ones that were studied, most of them didn't pan out. But because there were in fact good clinical trials done, we were eventually, didn't take a few months. Those were longer term studies because you didn't know whether an AIDS treatment was working within a short period of time in those days. So we learned a lot, and eventually we got to the point where we turned HIV infection into a chronic illness and not a life-threatening disease. In Ebola, we faced an even more challenging situation because the people who were sick were in countries that didn't have high-powered, highly technical systems, and we had populations that didn't understand what was going on and had standard practices, burial practices, other kinds of things that made it very difficult to control transmission. Even there, eventually, we were able to start some clinical trials, but unfortunately, they didn't start until the epidemic had waned, and that's a reason why some of us are proposing that if that, I don't think that's going to happen with this epidemic because we've got plenty of cases and enough to do the studies. But if the epidemic did wane, and this could be possible for studies of a vaccine, we might have to carry the treatments over a period of time until the disease came back and we could see whether something actually worked.
I think one other question, and then we'll get back to the Q&A lineup, and I'll let Dan take that, is, the president has said, let's relax everything post-Easter. I guess, Michael, to you, Richard, to you, in terms of thinking about the economy, is that remotely possible? Is that remotely a good idea at this point? What are your thoughts?
It's not a good idea. It's just not. I don't think there's much hope that we would be at a low enough infectious rate in 2 weeks to stop what we're doing. Maybe I can pass it on to Richard for the.
Sure. So I'll take that as the answer that we shouldn't open it back up. I mean, I think, to plug Dan's podcast, if we had a trade-off here, the trade-off is more infections, more deaths versus less of a recession. I think that's the trade-off we're talking about here. And from my perspective, if everyone's going to get infected and it potentially is fatal, I think that's much worse for the economy than a few more weeks of being, as I mentioned before, kind of shut off. But it doesn't seem likely to me to be prudent to open up. But that said, if there was information that said, hey, we have slowed the path of the virus and people aren't getting infected, or we have a real treatment that can solve some of the issues, then I would say, yeah, okay, let's think about opening back up. But, I think the things we got to think about in terms of the economy is just, keeping some of these businesses afloat over the period of time that we need to, again, kind of shut off the economy to some degree.
It seems that many people believe this idea of ending social distancing or really ratcheting it back by Easter seems arguably irresponsible. But just to explore the idea, Richard, what trade-offs, and I'm not, no plug here, what trade-offs are there for that we are making? I mean, what is the economic impact?
Yeah, so I think the trade-off is, which I think, it's kind of in our Q&A, but, I think that the issue I think of is the small business. So I'm thinking about the mom and pop hardware store, the pet store, as the question suggests. Those businesses, again, probably don't have, say, a year that they could just shut down and still come back and survive. So they might not employ, say, 50 people or 100 people in a community, but they might employ 5 or 6. And if they're shut off for a month or 2 months, they might not be able to open back up. And so that mom and pop pet store becomes, a big corporate one, PetSmart or whatever. And so I think that's what's in danger. And I think one of the things in our economy that we like is we like people to be entrepreneurs and we like people to try new ideas and things like that. And this would be setting back a lot of those folks. the guy that's starting a business, this is probably a tough time to start a business, say 2 months ago. And so I think that's the trade-off. I think we're giving up a lot of that. Walmart, those big corporations, I think they're going to last. Whether or not they employ all of their employees through the whole period of time is something we can talk about too. But I think we know those businesses will survive for a few months. It's those smaller ones that we need to worry about. That's the trade-off.
Mike, what another quick question here before we go to the questions in the queue. Mike, what signs are you, as an epidemiologist, right, as a person who's just sort of, I imagine you constantly poring over numbers and charts and graphs and stuff. I don't know if that's right, but like that's what I imagine. What are you looking for? What signs do you need to see for you to say, oh, okay, maybe we can begin to ease off some of the social distancing?
Well, I think there's nothing we're going to see completely in the numbers of cases. We're looking for the effect of social distancing. We haven't even seen that yet. Once we see that, we're going to be able to estimate when the case counts start falling, and most importantly, when the number of infectious individuals starts falling. But if we ease off while it's still a significant proportion of the population that is infected and a very large proportion of the susceptible, we would immediately see the epidemic turn around if we ease social distancing before we see really pretty low, as in right now what we're seeing in China, which is not a lot of cases, low enough so that we could do the very proactive testing, isolation, and contact tracing that we all hope can really get on top of this without burning through the population, as Ed had mentioned.
So that's really, in your mind, a key variable. You want to see the infection rate just start to really drop down, fewer and fewer, day over day. You see a downward slope.
What we need to start thinking about is, I think Richard was touching on this, things are going to change. Enterprises are going to change. Small businesses are going to change. Big businesses are going to change. And we need to think of ways that we can have a new economy while we're waiting out this very long curve. I don't think it needs to be we're done social distancing. It might be a much more gradual easing of certain pieces of the social distancing strategy.
That, Allison, can you say something to what Michael just said there?
Sure. I mean, right. Like, and does not make your stomach drop when you hear Mike say that, because if you start thinking through, so how do we build policy around that? And then how do we implement policies that achieve that? It sounds like an on and off, maybe not fully off and fully on, but these sort of partial back and forths. That's really hard to implement if you're a school district or a university or a community with a lot of small businesses in it. And just like we need, I think, creative solutions to, protecting vulnerable populations, we're really going to need some creative solutions to partial, repeated cycles of clamping down and easing up. But I agree with Mike, and I don't have the acumen to look at the models that he does, but it looks like that's what the next 18 months are going to be.
Something that we've seen that again, I think, again, keeping with the social distancing that we've seen, at least with grocery stores, is, grocery stores are offering, say, senior owner hours, where there's fewer people in the stores. I have friends who've sent pictures of waiting in line to get into Whole Foods where everyone is 6 to 10 feet apart. You could imagine something where it's just like, you can't have more than, 10 people in a store of X size. These are things that potentially could help some of those businesses open. I'm not saying it's the right thing. Again, I would defer to the medical folks here on what the right thing is, but you could imagine, we've all seen the sign, by order of the fire marshal, only 200 people in this room. That just all of a sudden gets divided by 10 or whatever it is. That might give some easing of this, but still keep that social distancing for the near future.
Susan, as you listen to this conversation, I'm curious, as you think about the development of vaccines or other treatments, if, you know, obviously having some effective vaccine here could really play a massive role in society sort of returning to something more similar to what we knew even a few weeks ago. If we were to invest more money, more resources into vaccine treatment development, would that speed the process up? Could we sort of buy ourselves out of this problem?
I don't think we can buy ourselves out of this problem. Vaccine development is not simple. You know, we started looking for a vaccine against HIV infection back 30 some years ago when I was working at NIAID, and we still do not have a vaccine against HIV. We progressed more rapidly with an Ebola vaccine, and as I said, there's a number of efforts on the way for vaccine development, but it's going to take much longer. You know, the numbers 12 to 18 months have been tossed around. That's only if we're really lucky and the very first candidates that go into study turn out to be really effective. And if, you know, 12 months from now, there are enough cases that we can really determine whether it's effective. First of all, vaccines are not given to desperate people who are sick. They're given to healthy people. They're going to be given to kids. Everybody is very concerned about how safe vaccines are. You have to be when you're giving back something to millions and millions of healthy people. So first, you have to determine that it seems to be relatively safe in small numbers in the phase 1 studies. Those are going on now. Then you have larger studies where you'll have to see whether they're producing the kind of antibodies that are considered to be protective. And ultimately, you'll need to see whether they're actually protecting people either from infection itself or from symptomatic disease, depending on whether we have good information on what proportion of people actually progress to symptomatic disease. So, you know, 18 months is probably the most optimistic estimate I could give for development of a vaccine. And if these first candidates don't pan out, if they have safety issues during phase 1, or they look like they're not, you know, getting the antibody levels up to the protective level, then, you know, people will be trying new things, and it could take a while.
And Susan, this is a question from the queue. If a vaccine is available, how will the effort of getting it out, getting people to use it, differ from the promotion of other more routine vaccines?
Well, you know, it's interesting. I think when people are really afraid of something, they're going to go out and get vaccines. I was saying, you know, like 5 years ago when Ebola was starting, all the people who are frantic about whether vaccines are safe and mothers don't want to vaccinate their kids, if there were an Ebola outbreak and there were a vaccine, everybody would be lining up to get it, just like they lined up to get the polio vaccine back in the 1950s, because polio was such a feared disease then. We've become inured to infectious diseases. People don't see measles anymore. They don't see diseases that have bad consequences, and so they're more concerned about the adverse consequences. But now everybody's really seeing what happens with this virus and the problems that it can cause. And so I think when it's being rolled out, there'll be a good response. But it will be very important to have a substantial amount of safety information. You know, if everybody's vaccinated, then any bad thing that happens to somebody after they get vaccinated, somebody's going to say, oh, it was caused by the vaccine. We're going to have enough information that will be able to counteract those stories.
Question from Rebecca in the queue. Will there be accountability to businesses large and small to keep staff on their payrolls, from restaurants and pet stores to big corporations? Richard, do you understand the provisions there?
I do. I was hoping that the bill would be passed by the time we started this, but as far as I could tell, they're still debating it in the House. So let's go with what I know. So there are provisions. It's more incentives to increase to maintain the workforce. So if you apply for certain loans in the bill and get money, you have to use it towards payroll. So you have to keep people, on the books. And then going out a year when if you've taken the loan or taken any of these measures, you can't pay executives a certain amount of money. You can't use stock buybacks for the bigger corporations. So I think for both sets or both types of firms, sort of think about the small ones and the big ones, there are these incentives to keep people on payroll. It's also the fact that they've delayed payment of payroll taxes. So obviously a big expense for small businesses paying those employer side payroll taxes, and they can defer that payment for 2 years. They have to pay half of it by the end of 2021 and then the other half by the end of 2022. And so there are these, way to think of it as just incentives for these businesses to keep people on payroll.
A quick question about this economic package. We've never seen anything approaching a $2 trillion stimulus bill, and we need to keep the economy moving to some degree. Of course, should we be thinking about deficits right now, Richard? How do you feel?
Yeah, so this is a tough one. Obviously, we are the Penn Wharton budget model, and we do federal budget, right? And so we worry about this stuff. So we're struggling with this. I think, of course, again, sort of going back to the way we're all thinking about these is there's the immediate impact of stuff, and then there's the longer term stuff. And I think we do a good job of handling, what is, if we gave a big tax break today, what effect does that have on the economy over time? Or if we do deficit spending, what effect does that have over time? I think we're putting less weight on that because we do expect that, depending on how deep the recession goes, we should be able to come back. If it's just a matter of opening the economy back up, you could make an argument that we would get quickly back to where we were. But that's coupled with, how important are deficits here, or how important is debt? I think it's important, but we're talking about historically low interest rates. All of those things kind of feed into that, how bad that debt is. And so I think we are not at the point where the debt costs are outweighing the positives of the social distancing and kind of shutting off the economy. But to be honest with you, I mean, all day for the last couple of weeks, all I've been doing is trying to sort out these models and figure out, what's that break point? At what point does it make more sense to open the economy back up? I mean, we're working through this to answer these types of questions.
A social distancing question, I think that probably goes to you, Allison, from Martha Curley. If two related families were vigilant about social distancing for 2 full weeks, can they get together to celebrate an important family event? And I think this really speaks to this idea of how do we practice social distancing in responsible ways, but also sometimes give in and do some things that maybe don't hew perfectly to the most strict interpretation of social distancing.
Yeah, thanks for that question, Martha. And it's a question I've gotten in various forms from lots and lots of friends and family over the past couple of weeks. You've got the basics in place. You've done the 2-week sort of self-quarantine at home. Hopefully you're monitoring temperatures and symptoms and everyone's completely symptom-free. Hopefully if you do get together, that doesn't involve a lot of travel or being out and about. Hopefully that's an easy coming together. I guess I would say, and happy to have the clinicians and epidemiologists weigh in here, if there are higher risk folks in those 2 family units, folks over 60 or folks otherwise, immunocompromised, still might just want to think about that, a second or third time. It's pretty clear that people can get very sick very fast from COVID-19. And if it's possible to reduce that risk, that seems like a good idea. If you feel like you've sort of ticked all the boxes and getting together with a group of folks who are at low risk at this point is still an acceptable risk, and it's an important family event, I wouldn't blame you for that decision. How's that for a total hedge? These are hard choices.
We're just trying to go through. We've got about 10 minutes left, and just want to go through these remaining questions if we can. Again, leaning into the fact that this is sort of a community moment. And I might mispronounce your first name. I apologize. Seyun Kim Do we know if it's possible to be reinfected after recovering from an infection or asymptomatic infection?
I think I'll speak to this a little bit. There's been reports of someone who had a positive test, a negative test, and then about 3 weeks later, another positive test. If that were happening regularly, we would see it. With the sheer number of cases that we've had, you could imagine it going through a household, going from one person to another, and then back to the first member of that household. And I don't think we've seen that. Longer term, it's much more of an unknown.
I can comment too. I know that there have been some speculation that some of these cases, people who got sick shortly after recovering, that there was speculation that they might still be shedding virus, and it might not be that they had fully recovered. So I think we're too early to really know too much about this. The monkey model suggests that there's some short-term immunity, but again, those have been done with related viruses, and there's small numbers of animals, and so it's just a hint.
Economic question here. This is sort of lightning round, everybody. So a PPE question, perhaps Richard, for you. Given the PPE shortage, how do you prevent further shortages as we go forward here?
Yeah. So obviously the markets respond to need, and it takes time to ramp up. I mean, I will say one of my favorite vodka makers is making hand sanitizer now, Tito's in Austin. So I think you do see the market reacting to this. And so, I think, if the government thinks, hey, the private people aren't buying enough, say, face masks or ventilators for that matter, then the government should step in and make sure there are enough for safety of the people. I think that's a role for government when markets don't break down. So, maybe it is the case that, again, I think there's some companies that are starting to make some cloth masks and things because they're clothing manufacturer. I think these things are all responding to, hey, the government might pay for some of this, and it gives us goodwill building stuff forward. And I think the government can step in and act as a buyer for a lot of those.
Here's a question, a very nice question from Renat, I think. Thank you for this question. To look at the silver lining, what are some potential positive unintended consequences that this pandemic might bring about? He says, I would love to hear how you all are thinking about that from your various sets of expertise. So that seems like we have 5 minutes left. That's at least give everybody about 30 to 60 seconds on the panel to answer that.
I've got a one-word answer, and it's telehealth. I mean, this is going to radically transform telehealth in very positive ways, and we won't be going back to the way it was before, even after the outbreak.
And just say a little bit more, Allison. Why is it good?
We've been wanting to do it for a long time. We've had the technology to do it, and we've just had sort of regulatory and billing and I think cultural barriers to doing it. And now most people who aren't front lines in hospital are delivering care, including our host Dave Grandy, by telehealth now, and a lot of those restrictions on billing and working across states have been removed, and no reason we have to go back. There can be much greater expansions in telehealth going forward that I think will be very productive.
Susan?
Well, it's hard to think about silver linings right now, but I guess one possibility is there are a number of coronaviruses that are related. I think I mentioned MERS, the Middle East Respiratory Syndrome, and the acceleration of research into treatments and vaccines that can cure this disease may also help development of some of these other diseases, which are quite problematic and also have regular outbreaks.
Michael?
I say, we have to change our society. We've known this before the outbreak. We know it because of the climate threat, and now we know that we can change our society. And I think if we have a lot fewer conferences and maybe some fewer cruises, that would be good too.
Yeah, and I'll jump in. Yeah, I'll jump in kind of a two-part thing. First one is I think, if your place of work was not open to telework now they have to be. And so I think going forward, I think if you had businesses that were hesitant to do telework. I think now they will allow it because I think, at least again in my situation, I think we can do our jobs. So I think that is potentially a good thing. And then the second thing is I think, necessity breeds innovation, right? So I think that, a lot of these things are going to come up with a new way to do something, or a new treatment of something, or a new widget or a new gadget in some way. And I think, that really people are out there thinking about things, right? And so to me, it's really spurring. It's a situation where people are starting to think about things differently than before. And that comes up with sort of innovative things, which I think would be a positive.
Very good. So we have just about 3 minutes left. And before the event began, before this panel started, I asked everybody to think about some take-homes they wanted to share and leave with folks on the call. So can we just go through that? And Susan, why don't we start with you? What's a take-home you'd like people to hold on to as they go back to the routines of their lives?
All right. Well, I think to me the greatest hope, the strongest reason to be optimistic is the possibility of developing effective treatments within the next, relatively short period of time, a number of months. Because if we have effective treatments, that will not only be able to treat the people who get infected and get quite sick, but it will also reduce the transmissibility. If we have people who are effectively treated, they won't be transmitting the infection, and that will help. So that's what I keep focused on and thinking about, and trying to be optimistic that maybe some of these treatments will turn out to be really good.
How about you, Richard?
I think the big takeaways, I think, is be patient. I think what we need to worry about here is the small businesses and the people that are hourly workers, and keep those in mind. So I think that's the danger for the next couple of period. And I think it's important to remember that this is different than other recessions that we've seen. Again, as I said before, this is kind of a shut off. We're temporarily saying people not do things we want them to do in a normal situation. And that's a very different situation for us to think about in the economy. But that, to me, that's what's happening now, and we need to be aware of that.
Allison?
I guess mine is a wish or a hope or an ask for people that if you are in a position to do so right now, to think about strategic uses of your financial resources, to keep paying people who used to work in your home, even if they're not coming in your home to do it. Think about when that check arrives for the government, buying a whole lot of takeout meals from local restaurants in your neighborhood and leaving crazy tips. Look in your Venmo app and see who you regularly tip at various service providers and send them a tip. Make sure they know you're thinking about them. I think it's easy to kind of tunnel in like, oh, how hard it is to do this stay-at-home thing. And if you are protected from some of the downsides of this and can share those resources, please do so.
Cool. How about you?
I'll just say that, other things are going to happen. This is a long curve, and we have to be ready for something else to happen on top of this. That could be another disease. Malaria isn't going to stop. Zika could come back. That could be a lot of other things. But, I think we can't, when the next thing happens, we can't give up. We need to keep adapting and doing what we need to do.
Perhaps a little more investment in our public health infrastructure as well. Rachel, turn it over to you.
Great. Well, I just want to take a minute to thank all of you for participating today. I think normally when we reach the end of a seminar like this, we give our panelists and our moderator a round of applause. I think you guys will have to believe that people at home today are giving you a round of applause and you just can't hear them. But I do want to say I appreciate all four of the panelists for participating today. Dan, thank you for moderating. I hope that you all have enjoyed this conversation as much as I have. And we look forward to seeing you at our next virtual event about this. Take care, everyone.